Hello and welcome. Good evening. This is Brave Coalition Foundation.org. We are so excited to have Dr. Andrea Moreira on tonight. She's a board certified plastic surgeon. Welcome, Dr. Moreira.
Thank you so much for having me, Christine. I'm so excited to be here.
Yeah, I would like to introduce Dr. Moreira. And first of all, I'm going to apologize. It's 5:30 in Texas, and I have 3 chihuahuas. I think it's their witching hour. So if you hear chihuahuas or children in the background, this is our new norm in the webinar platform. But we've been doing these. Brave's been around about 9 years, and it started to really help women with breast cancer reconstruction. But as the COVID has moved in, we've kind of pivoted a little bit to talk about, breast reconstruction as well as people with cancer and the immunity issues around COVID, and even just everyday life for everyone out there wondering about COVID. So first, I'll give my background to Dr. Moreira. I've actually had the pleasure of knowing Dr. Moreira for a couple of years now with the industry I worked at. But I'd like to be quiet. My chihuahuas are yelling at somebody. I'm sorry. Dr. Moreira actually did her undergrad in medical school at the University of Sao Paulo. I worked in Latin America, so really had experience in working in Latin America. Don't know my Portuguese yet. So her undergrad in medical school was at Latin America, Sao Paulo. She went on to do her cranial facial in Michigan, and then she went on to the Cleveland Clinic and did her plastic surgery fellowship at obviously world-renowned Cleveland Clinic. She was not only board certified in plastic surgery in Sao Paulo, but she came over to the US and had to go through the boards again, which is, I know she's very humble, but to do the boards once again and do all of the recertification and boards. So she's really double boarded not only in Latin America, Brazil, but the United States. So I got through that. It was a very stressful time because the dogs are speaking their Portuguese Chihuahua. So hopefully it'll be quiet from here on in. So Dr. Moreira, thank you. Thank you. And I'd love to talk to you.
Thank you so much, Christine, for having me here. I'm very excited. I'm a really, really great supporter of Brave. I think it's an amazing, amazing institution. I love that you guys are focused so much on breast cancer and breast reconstruction. I think there is a lot of patients outside that can relate their needs and their questions and concerns, and you have been there for them. I think it's just unbelievable. And I've known you for years, and you have been there for them for years, which I think is very exciting.
Yeah, no, Dr. Moreira, being a female plastic surgeon in this space, I can imagine women, they relate to you, their mothers, like I know you're a mother. And speaking of mother, it's Mother's Day this weekend. We invited you onto the Brave platform to really talk to us about, how you talk to your patients through that journey. And then when they get to the other side, the more happy side, where they've chosen their reconstruction options, restoration options, sort of that advisement moving forward. They go back to their lives. I know women that get reconstructed, they're right back into being mommies again. And what's kind of your conversation? It's probably different with every woman, correct?
Yeah, it's very different with every person, because this is a disease that affects women in a personal level, and it almost is a visceral level. It's so difficult for them sometimes. And they take it in different ways. I've seen patients who just put the warrior, I'm going through this and I'm going to get better. But then we have the patients who are much more sensitive, and that is a very difficult journey for them. So everybody's different, and you kind of have to make sure that you are able to talk to the patients on their own terms, not your terms as a physician, and understand what they're going through the process. I've been doing that for many, many, many years. And my patients come to me very frequently for everything, even for things they're not related. I tell them, you're going to have your breast surgery, but you're going to be married to me for many, many years.
That's
because
great.
I do
Lovely.
follow them. I want to make sure that they're doing well. I know their families. I try to understand their lives and see if I can help it somehow, because it is very difficult. But again, it's a personal journey. There is no cookie cutter. There is no recipe for everyone. And I think as a surgeon, I want to adjust to what's going to give them the most satisfaction over time. And satisfaction after breast reconstruction is an area that we focus very much. We have several studies looking at this and looking at how women choose reconstruction, how they perceive their reconstruction, and how happy they are, because that's going to change their lives after. That's going to change their family dynamics, the dynamics with their husbands, that people don't talk about this very much, but it's definitely something that is very important.
I meant to mention you've had a lot of awards in the research arena for the work you've done, and my dogs were really bothering me at the time, so I missed that part of your introduction. So, being that you've done a lot of research in this area, what are some of the things you're researching? It sounds like around breast reconstruction satisfaction, quality of life.
Yeah, there's a lot that I do. I have several, we have a database of our patients, and we use that to establish what works and what it doesn't work, and to make sure that our patients get their best a world care service when they come in. So one of the areas that I researched about is quality of life after breast reconstruction. There is a quality of life protocol or questionnaire, if you want to call, that was designed by a group at Sloan Kettering, having a front line, a
Dr.
female
Cusick,
doctor,
right?
Dr.
Andrea?
Pierce.
Yeah.
Exactly.
Rescue.
Exactly. Yeah, exactly, the rescue. And that asks several questions to the patients. They're very important for their lives, how satisfied they are with their breasts, um, about her psychological well-being, about her quality of life. And we've looked at all the patients who had reconstruction and looked at different types of reconstruction to try to find out what makes patients happier or less satisfied with their reconstruction. And that has been an unbelievable experience, because we find out that sometimes how you feel about life, how you approach life, has a lot to do with your overall being, not so much to the kind of reconstruction that you chose. Um, and I think this is really important to know. The other things that we found out is that patients tend to be very satisfied when they have breast reconstruction. Um, and there is a higher satisfaction rate slightly when they have their own tissue. But in
Mm-hmm.
general, patients who also have implants are as satisfied during a longer period of time, because in the beginning we thought that people would be satisfied with the implants in the beginning, but as the time passes, they won't be as satisfied anymore. But the new studies had shown that maybe they are still satisfied, which is a great finding.
Yeah, and it's really expectations too. People like you to explain to the patient what the expectation is. Is it going to feel the same as our normal breast? And there's just different nuances. And the breast cure, I know, measures sexuality, things like that.
Yeah.
After, so I admire the work you're doing, and a lot of I think you're much more advanced in the United States in this area than maybe some of the other areas of the world, because the breast cure is. And we have comments on this. So if anyone's watching, which there are people watching, I put the information you suggested up there so they can ask their surgeon, about
Perfect.
this type of work.
Yeah.
What other suggestions do you have when a woman's finished getting on with their life around nutrition, mobility, exercise? What are the top things that are recommendations you might have? Because a lot of women right now are going through this in the next few weeks. I know the elective part of the surgery has been put off, but I do know some patients watching that are about to have mastectomies, etc. So.
Yeah, I'm very happy that we're going to start providing care for these patients, because their care had to be put on hold for a little while with all the COVID-19 issues. But I tell my patients, and that might sound like a cliche, but it is a journey. Every day is a new day. And you have to take it without thinking too much about the distresses of the day before. Because, you know, and again, that's different. You have patients who are BRCA positive, they don't have cancer, they're going through reconstruction to prevent a disease. That's a complete mindset than a patient who actually is going through chemo and radiation. One thing I tell them is to focus in the future. It's very difficult. It's something that you have to reassure them all the time, because when you're through the motions, it's very difficult to see the light in the end of the tunnel. So take it at a time. Try to take half an hour to exercise, to do something that feels good. If you like painting, try to get your head away of the whole cancer situation and see if you can take few minutes in the day that you can actually settle down. The other thing that I recommend is to find a support group somehow. It could be a family member, it could be your spouse, it could be a group like Brave, because I think we're stronger when we are together. Um, the other thing that I tell them, do not pay attention on the distractions. I know it sounds weird, but everybody is different. And I find that sometimes we hear very bad stories and
Hmm.
horror stories, and the patients get focused on that. And their story might just be beautiful and it might just do great, but you don't want to get distracted by what's happening around you.
Because you usually hear the
Follow
negative things, not
your,
the positive things. Your
yes,
brain is wired that way. Yeah.
yeah, you tend to hear a lot of the negatives, but you have to focus that there's many women that go through this and they go back to their lives, and they actually come out of this stronger. My patients, I always laugh and feel really happy when I see their hair growing. There's something about the hair growing that makes me very happy. It's like you've gone through a horrible phase, now you're getting better. And I think that's the whole point. Nutrition is really important. I tell my patients to avoid smoking. You
Oh, yes.
know, you
Yes.
know,
Very much.
do as little alcohol as you can, and really pay attention of what you eat. We know there's so many risk factors to this disease, and obesity is one of them. I'm not saying that following strict guidelines you'll be okay, but I think follow strict guidelines will give you a better quality of life over time.
No. And you're such a just admiring you as I've known you. You're, mom, you're super mom, plastic surgeon, you do your yoga, you're sort of you emulate what if you can do it, everybody out there can do it because you've
Of
got a
course they
really
can.
busy life, Dr. Moreira, and I just think the world of you. So I'm sure there'll be a lot of people writing to you and wanting to come see you. You're an amazing surgeon. I know you're busy with your family. We'd love to have you on again. We may get some questions. Are there any websites you recommend women go to? Probably the Cleveland Clinic would be a good one, right?
Yeah, there's quite a few websites that give a lot of information. It is reliable information. Sometimes Dr. Google might not be the best. You know, even I go to Dr. Google sometimes. It's crazy.
Yeah,
But yeah. But
Dr. Google.
I think I know we all went to Dr. Google for COVID-19, didn't we?
Yes, I went to Google a lot for that. Yes, and then I tried to
Oh
figure out
my
what was
God.
real. It's
Yeah.
really. But
But
are you back to operating, Dr. Moreira? I should have asked you that in the beginning.
yes, I am. I am. We're
Good.
back. We never got a real large surge in Ohio. And I think I can thank you, our administration in the state for this. The Cleveland Clinic has been actually very active and they have been great in trying to respond. So far, I think we are in good shape. Yeah, we're back operating. So in terms of resources, I would suggest the Cleveland Clinic .org, and you go to the breast reconstruction webpage is Cleveland Clinic Breast Reconstruction. The other thing is that we just launched an Instagram page, which is really good actually, and is Cleveland Clinic Breast Recon. The
Put these
other,
on the website for us
yeah,
to work on.
the other resource that I think it's always great, and there's a lot of good information, is plasticsurgery.org. And that's our main plastic reconstruction surgery website.
Yes, it's perfect.
Yeah.
Good. Well, we have a
Yeah.
lot of homework for your the patients watching, and anybody watching. Really, it's just good information for people to have, and it's reliable versus Google
Oh,
411.
yeah. Yeah. Google
Well,
can get the good and the bad. That's the problem.
yeah, and Wikipedia. Well, Dr. Moreira, I'm just honored to have you on. As I was trying to say in the beginning, I don't know what was conveyed, but having that double board certified plastic surgeon, not only in Brazil but also here, it's double the work you went through. So we appreciate you being here in the United States to help us, and love to have you on again. And I will put my dogs in quarantine behind sound doors. You have
Very good.
great night. Thank
Thank
you.
you so much, Christine. This has been great. I'm so excited to be here and share the experience with you.
We'll see you soon. Thank you.
See you soon. Bye.